A little bit. Yeah, so if you guys don't know, this is my dad, Dr. Cline. Oh, I should have had this up before. I'm so sorry. Dr. Cline is a full spectrum family physician. He's a fellow of the American Academy of Family Physicians, a retired colonel in the United States Air Force. He's here to talk to us today about full spectrum family medicine demonstrated through his military career. He runs a nonprofit organization that is dedicated to bringing mind, body, and spirit healing to his patients and community. He also taught me how to read. He taught me how to walk. Taught me how to be funny sometimes. He let me stitch up my brothers when they got hurt. He is the doctor, colleague, mentor, friend, husband, father that I strive to be more like.
Thank you.
Dr. Cline.
I don't think I need this. Okay. Yep. Wow, what an introduction. I feel like I know this guy really, really well. So family medicine interest group, military medicine interest group. I prepared basically a slideshow that is, what I did on my summer vacation, right? So it's 29 years of summer vacations and fall harvests and spring festivals and those sorts of things. So I'm going to go through and really kind of explain what happened during my career. We were just talking actually earlier, was it Richard? We were talking about how you have this passion that's put on your heart and you feel like you want to do something. And so you follow that passion and you think it's leading you to a certain place, whether it's, I want to be a family physician, I want to be sports medicine, what do you want to be? And you're headed towards that direction. And oftentimes, I think, you end up in a different place. And so as you guys are sort of figuring out, what you want to specialize in, what you want to do, where you're going to be in 5, 10, and 20 years, what the end of your career is going to look like. My advice would be to focus less on that and just follow the passion that's in your heart. And that will lead you to the place that you're supposed to be. And that's really a big thesis of my talk, is I just kept pursuing things that I wanted to do and I love to do. And I had a huge variety. I was able to practice full spectrum family medicine and had a wonderful career in the Air Force. I will say I loved 99% of it. 1% of it was not so good. And that's great. That's how life goes sometimes, right? There's a lot of people out there that are dissatisfied with a much greater percentage of their life, right? So I think I'm really blessed to have gone through that. I've heard what you guys are doing as a class and as a school. I am so jealous that I didn't get to go to a DO school. I just didn't know, honestly. When I grew up, I didn't know. And I've wanted to learn osteopathy pretty much my whole career. As soon as I got into residency, people were doing these things. So first thing I would say is if you're at all interested in doing primary care, hone your DO skills. This is your chance to do that and become excellent at it. Pursue that. All of the Western medicine stuff, you're gonna get that over and over and over again. And if you go into a subspecialty, as far as I can tell, my experience in my career, there's less of the osteopathy that's used in that on an everyday basis. But man, it's going to make you such a better primary care doc, and you're going to be able to solve so many more problems. And I'm still at this day, still trying to learn. I'm going to a lecture tonight to try to learn a little bit more. And then the last thing I'll say is, by way of introduction, is that I'm super impressed with the quality and caliber of this school. I get reports, and just the investment into your education in terms of technology, in terms of high quality faculty, and then the students that come here as well. So I'm really impressed. I'm super pleased that my son is here, because I trust this university to provide the best education and the opportunities that he'll need and that you guys will need to follow your dreams and become the person that you're meant to be. I did want to thank Dr. Sorweed for coming. I appreciate you being here. I know you got a lot on your plate coming up, and I feel like we're very kindred spirits in terms of our experiences. And so I think he could probably be giving this lecture just as much as I could. But I really appreciate you taking the time to be here. to listen to what I have to say, but also, you're here for the students, and you're supporting what they're going through here. So I started I'm going to try to, maybe I can do this. Let's see if this will work. Yeah. So Tulane Medical School, loved it. Rich experience. You see Charity Hospital up there on the left. Very, very poor community. A very, very needy community. End organ diseases. People who had missed primary care for 30 and 40 years. So that was the story of Charity Hospital. When I was in medical school, I didn't have a whole lot of exposure to primary care. It was an expensive school, and so to pay for expensive schools, you have to get a subspecialty job that pays more. And so they were really pushing you in that direction. Well, I took a military medicine scholarship, HPSP guy, and so I had the freedom to choose the specialty that I wanted to go in. And so I was lucky for that. Was at Tulane where I had my first international medical experience. Went to Guatemala. I spent 2 months down there as a medical student. I got to deliver babies. I got to do a lot of rural medicine. And so I think that really shaped my career, as you'll see. I joined the Air Force. I did my residency at David Grant Medical Center in Travis Air Force Base down in Fairfield, California. Wonderful experience. I will say, those of you are going into the military, I would highly consider a military residency. I think you may have the option to kind of go out into the civilian world as well. Military residencies, I think, are super high quality. They attract some of the best faculty I've seen across the nation. I've been in medical education for a lot of my years. I was faculty member for 7 years at a teaching residency program, and then I was the director of institutional operations, which is the supervisor for the program director for a couple years. And then I'm still involved now. I teach out at Ukiah Valley Hospital in Mendocino County. And so I've seen medical students, residents, faculty from University of Nevada to University Davis, UC Davis, at the medical residency programs. It's a high quality that you're going to get there. So I would really consider that. And again, it's a place that, these institutions have government funding, right? And so they get you the things that you need, great technology. So I really enjoyed that there. My first assignment was at Nellis Air Force Base, home of the fighter pilot. And this is really where I learned to hone my skills. So, family medicine is a 3-year residency. And you're really not an expert in anything when you finish those 3 years, except you're an expert in dealing with feeling uncomfortable and working through that, right? So, when it comes to the heart, right, the cardiologists, they've had training, and they don't feel uncomfortable about anything when it comes to cardiology, right? They get out of their training day one, and they're very comfortable in the things that they know how to do. The family medicine residency does a couple things. It teaches you how to learn. It teaches you how to be self-sufficient, but it teaches you how to be comfortable being uncomfortable and figuring things out. You really need to, when a patient comes in the room, you need to figure out sick, not sick, right? Big categories. What's going to kill you today? Okay, what can I do to help you in the short run? My technique was told to me by one of my mentors is, you don't want to consult everything out those first 3 years. Your first 3 years out, it's finishing school. Right? You need to pretend like you're still in residency and just work hard to get the answers that you need. So you could have a patient come in, you're like, I don't really know what it is, but I know it's the heart, so I'll refer to a cardiologist, right? Or, my technique was, I really don't know what it is, but I'm going to pretend like I do. So I'm going to order, a CBC, a chemistry, a thyroid, maybe I'll get, and then, but that night I'll spend an hour researching because I learned how to learn. Right, and I knew where to get the knowledge. I knew I could phone a friend, and then I would go back the next day. And you start building knowledge upon knowledge, right? And you start making connections, and then the things that you didn't know, you suddenly know and are easier for you to do. Same thing with procedures. So I loved doing procedures. I was really close to become a general surgeon. The biggest problem for me with general surgery is you couldn't deliver babies. So I was... My literal plan was I'm going to do a general surgery residency, and all of my electives, I was going to do an obstetrics. And then I was just going to be able to do general surgery and deliver babies. And, along the way, somebody said, that's not American practice. That's a third world, undeveloped, a different place where you can do those sorts of things. And eventually I did go to those places and do those sorts of things. But I love procedures. And so the same sort of thing, right? When I got out of residency, I had done 11 vasectomies, which was enough for them to say, you're certified to do vasectomies, right? But if you need a vasectomy, that might not be enough for your doctor to have done 11, right? Maybe you want your doctor to do more. And so if you go a year or 2 or 3 years without doing a vasectomy, it gets so rusty that you get a little concerned about doing it. And the opportunity to retrain is much less. And so that's the other thing is, you get out of residency and you do the things that you hone your skills, you practice your skills. And so now, over 800 vasectomies later, it's like you could do that in your sleep. But the key to that was pursuing that with intent after residency. After residency wasn't the time, I've made it, it's time to relax. After residency is finishing school. I wanted to point out a couple great things I got to do. I did get to go to Paraguay on a medical med-ready, and if you guys know what that is or interested, we can talk about that. You see me on the right, commissioning a husband and wife who later, down below, about 9 years, I think it was about 9 years later, I delivered their baby. So you get to do really cool things, and different bases actually. So the picture on the right-hand side is at Nellis Air Force Base, and the bottom is at Travis Air Force Base. You run into people, you do different things, see different colleagues, and it's a wonderful experience being in the military. Sentinel event in my life, at least, was 9/11. This sort of changed everything for all of those in my generation, especially in the military. This was the theme of my military, the global war on terror. You guys will have something different, a little different. I pray that we see the end of all war. Honestly, I pray that we see the end of poverty, we see the end of hunger, we take care of vulnerable people, that we can recreate this world to something that is what it could be, what it really could be. There's no reason that we need to have poverty and hunger and homelessness and crime and all these vulnerabilities. But I fear that there will be wars and rumors of wars, and I fear that you guys will have your own challenges, whether you're in military medicine or not. The United States is not in great shape. I don't know if you've heard, right? We politically, financially, there's some tough challenges out there. So civilian medicine is probably, well, it's definitely going to see a massive reform. It may collapse the way we know it. It's going to be an interesting career for you guys, whether you're on the civilian side or the military side. We've got a lot going on in the world right now, and but this was my Sentinel event in my career, and I dealt with it, and you guys will deal with your Sentinel events as well and get through that. I remember when they ran into the towers. I was actually on my way to the hospital to do a vasectomy, believe it or not, and ran into the tower, and I thought, what an idiot! Who's so worst pilot? Was he drunk? Like, what happened? I had no concept that this was a terror event or that anybody would do that on purpose. I got to the hospital in the meantime, and I don't know if I think they were like an hour apart or something like that. But I got to the hospital, and the second one hit, and it was like instant, right? There's no way two accidents like this could happen simultaneously. And so, what can we do? What can we do? Well, let's go to New York. My hospital commander was like, let's get on a plane, and started organizing, and let's go. We're going to get survivors. Anybody who has trauma experience, let's do this. So I signed up. Got my bags packed. About 11 hours into it, they said, "There's no survivors. There's no work for you to do there." Over 3,000 some odd people had died in that single event. So I decided I wanted to do search and rescue. So I joined a HH-60 squadron at Nellis and did search and rescue. And one of my favorite jobs. It's a great job as a medic because I wasn't super into pulling the trigger and shooting things and blowing things up, and that's kind of what you're joining. When you join the military, that's what you're supporting and what you're doing. So it was super cool to me to be part of something where we would intentionally go out into a combat zone, go into danger, pick up people who were injured, whether they were on our side or not on our side. Honestly, we pick them up and bring them back and care for them. And that was super cool for me to be able to do that mission. A couple shots of, these are my photos of doing some aero refueling. I'm taking the picture from the helicopter of the guys in the C-130 there, just hanging their feet out the back, and got a hero shot of me. I have three combat deployments, Afghanistan, Iraq, and Somalia. And so my first combat deployment was to Afghanistan. This is the map. These are all the places that I visited. So we were part of this, and more actually. We were part of the H&H or HH-60 Combat Search and Rescue Unit. And so we would go pretty much everywhere. See the part in the middle that I didn't go to? Those are mountains. Some of the tallest mountains in the world. They're called the Hindu Kush Mountains. And we did actually have some issues up there, I'll say, that were solved by a different organization that shall continue to be named unnamed. Technology back then was a little different. Skype was just coming out, and I tried to Skype with my wife, and it was not very successful. So yeah, very patchy. I don't know if you guys ever knew this, but like you used to connect to your phone line, and you'd get onto the internet, and you'd hear and then you would connect to the internet, and it wasn't so great. So this is a photo through night vision goggles of our sister ship. You know, we always flew in two ships, of course, and you see the aero refueling out front. While I was there, we had did some trauma, so I figured you guys might be interested. And anybody know what this one is? Pneumothorax. I heard it. Who? It's from here. Was that you? Gold Star. Okay. Yes, from our budding orthopedic sports medicine fellow. Yeah. So pneumothorax. I don't know if you can tell what's wrong on the left side over here. I'll point your attention down to this area. It's kind of hard to tell what's going on there. And then on the right side, I don't know if you can see the tube that's supposed to be lined up with the spine is pushed way over to the right. Lots of white stuff over on the left side with not a whole lot of vasculature. That's a hemothorax. So it's just pushing over, and you're actually getting tension on that other side. Not a lot of lung tissue left there. These X-rays like this are really oops. I should have put a chest tube in that guy when he's in the ER. I shouldn't have sent him to radiology to get a chest X-ray and find out, oh my gosh, he's going to die in 17 seconds. Get a chest tube in that guy. So these are guys who are like amazingly stable and enough to get to an X-ray. The radiologist sees it and kind of chokes a little bit. I don't know if you can tell the difference between the pink stuff and the purple stuff. I got called in for an ectopic pregnancy. So this was I'd done a OB fellowship, and so they severe pain, and she had a positive HCG. We didn't have a quant. We weren't able to tell exactly how what that was, and ultrasound showed nothing in the uterus. And so I scrubbed in to help with it. We did a fan and still incision, which is the lower incision you make for like a C-section or for GYN surgeries typically. And oops, we ended up with dead bowel here. So I was like, well, I can assist you now, taking part of the small colon out. I got to do a mission which was critical care air transport. This is ICU in the air. So I did get to do quite a little bit of work as an ICU doctor. This was in the air, and so you'd have pretty much everything that you'd have in a medical ICU, surgical ICU, on the back of an airplane and transport. So and you can see here the lower right-hand picture. There's enough of those tattoos that this is not a HIPAA violation, and his face doesn't look like that anymore. So. But this is a typical CCAT setup. You see the whole ICU over the top of his bed. Next assignment was in Las Vegas, apart from Nellis Air Force Base at UMC Medical Center. This is where I did my OB fellowship. And this was, my wife will tell you, I invested nearly every, I won't say second, but almost every minute that I could into this. So it was a 12-month fellowship in OBGYN. And I got another month out of it. I got the military to agree to a 13th month. Um, and I tried to do, I knew I had limited time. So I'd already been out practicing family medicine for 4 years. I had done about 300 vaginal deliveries at that point. And, and I knew that this was the one chance I was going to get. So I did as much as I could to learn as much OBGYN as I could, and ended up practicing full spectrum obstetrics up until this day. Um, Family medicine offers several fellowships, but it also gives you this opportunity to really create your own career. One of the advices I got from a mentor when I was in medical school or in residency was that the job of the family physician is to connect to the community. So, hey, do you want to do colonoscopies? Do you want to do, C-sections? Do you want to do sports medicine, injections? What do you want to do? And the point is that's a little too me-centric, right? You go to your community, and what do you need in the community? Well, I'm in Dallas. Okay, well, they have a GI doc doing colonoscopies on every street corner, right? Like that's why in Dallas, you recommend a colorectal cancer screening every 2 years, right? Because they got to afford it, right? But whereas in rural Oregon somewhere, no, every 10 years is fine. That's actually evidence-based. That's good. So know your community, right? And design your practice and your skill as a family doc, your skills after your community. I may not be surprised. I didn't do any addiction medicine. I didn't do any severe mental illness in the military. My whole military career, if you get addicted to drugs, we see you once and you get kicked out, right? So, and you have a severe mental illness, you either didn't get in or you get kicked out. But later in my career, after I retired, I started a free clinic for a rehab clinic, and I had to learn. And that was my patient population. And so I went to mentors, went to weekend seminars, these sorts of things to figure out how do you do medical assisted therapy, how do you treat severe mental illness, what are my resources? Again, being comfortable with being uncomfortable, right? So figuring those things out. So that was my fellowship. Went to Dave Grant Medical Center back in Fairfield for my first assignment as faculty. Spent 7 years there. One of my, again, favorite assignments. The 1% really is mostly the deployments, right, that I didn't like. But there's a lot that I liked in there as well. So this was a great hospital. While I was at Dave Grant, I deployed to Iraq. And so this guy on my right, Vic Bebarda, was a guy I went to school with, hadn't seen in years, and lo and behold, we ended up on a deployment together. And he and I did a bunch of things together. He was an emergency medicine, critical care trained. And so my biggest memory of him was one of our soldiers took too much aspirin, tried to kill herself after a sexual assault, green on green sexual assault, horrible. And she nearly killed herself with aspirin. And so it's a tough ICU course with aspirin overdose. And Vic, I was in the ICU, and he helped walk me through that and figure out how to get her stabilized. And she was one of the few people that we had to keep more than 24 hours before sending them to Germany. So the typical plan was you'd get shot mostly or blown up or whatever. You'd come in, you get resuscitated, go to the OR if you need that, and then come to me in the ICU and get stabilized. And then there's a plane coming at least every 24 hours. And so at most, you'd be there for 24 hours. Sometimes, if you got to my ICU like an hour before, sometimes you'd be ready to go and you would go. But she had to spend, 3 or 4 days with us before she was stable enough to transport. And you meet friends. You guys are, those of you who've done some training, you've already done that, and you will cross paths, and you'll be able to instantly trust each other and go through hard times together, and that's super, super helpful. I'm proud to be a Tuskegee Airman. I call myself a Tuskegee Airman, 332nd Medical Group. The 332nd was reinstituted for the Iraq War, and that was our group. I got to meet some true original Tuskegee Airmen in my career. They came up to meet us in Iraq, actually. And then I've had a chance to pursue meeting them at other places. Watch the movie if you haven't seen it. Just a great group of people. I'm super proud to be able to call myself that. I thought I'd go through a quick demonstration of a day in the life of Iraq. So here's the helicopters coming in at the landing pad, and folks are coming off the helicopter in front of us. we had somebody before I got there had set this up with the flag and Heroes Highway. So you're coming off of the helipad in the back there, coming through what we're calling Heroes Highway and down into the emergency department here. I was there actually for 6 months, and I was there for the time period where we transitioned from tents into a hardened facility. So it was a super interesting time. But this is a tent hospital that was set up. This is before the mass casualty. So everything's fine. We know there's casualties coming in. You take every chance. This is actually a great image. Right? Yeah, exactly. So a great image. I got a book in my hand, right? I was reading Menino's ICU book. It's the blue book. So family doc. I think I spent a month in ICU during my residency. And now the military deploys me. They actually deployed me as a ward doc, but one of the ICU docs had to leave and I was the replacement. And so it's like, okay, be comfortable being uncomfortable and figure this stuff out and fast. And so I always had Marinos. I read the book cover to cover, some of the chapters more than once, and I obviously had a lot of support. And then the other part of this picture is sleeping wherever you can, whenever you can, to try to be ready. So this is another group that were just waiting for mass casualties. This is a pretty typical deployment scene, and 80% of your deployment is waiting around for stuff to happen. The picture on the right is of a ward. This is a medical ward, post-op ward, and this is an ICU. Actually, we could get 2 ICU beds into this little location, or not ICU, surgical beds into here. So that's the OR room there. This is what a mass casualty looks like. This is the ER, and then these are some typical wounds. So I just put this one up there as an interest. I thought maybe you guys would like to see some of the war injuries, but we took care of Americans, Iraqis, civilians, military. It didn't matter. So if you're sick and injured and you got to us, nationality didn't matter at all. The picture on the right are just fragments of stuff that we took out. This is in one shift. Obviously, that's one night of work. Obviously, there's a lot more of that in a full deployment. One of my favorite stories is of a Army dude. Okay. You got to get used to that. You got to teach him. I'm an Air Force guy, even I don't know that. So this guy, he's walking on patrol, got his body armor on, got his M16, doing his Army thing. And someone comes up from behind him and punches him on the side of the head. So he turns around and he's like, "What are you doing?" Raises up his gun and takes him down. And he's like, "Well, let's go figure this out." And sure enough, he's got a knife in the side of his head. It wasn't punched. He was stabbed in the side of the head. He walked into our ER. Yeah, they put him in a Humvee and he walked into our ER. So pretty cool story. This is an interesting. I don't know if this has ever been done. And I think someone who knows what they're doing might question my technique here. But we had a pregnant lady who was shot in the abdomen, and the fact that she was pregnant saved her life. The fetus was probably about 22 weeks along, and so went through her uterus, out the other side, and the bullets landed on this side. Actually, I think it's this way. But anyways, the fetus saved her. But this is a curette to try to remove the placenta through the hole that was up near the cornua of her uterus. So trying to, instead of removing from below, removed it from above. Oversewed that. And this is one of those things, like not a lot of GYNs, have experienced this, right? So this is one of those things like, I did a fellowship, they called me, you have some general surgical techniques. I had a general surgeon, obviously there with me, actually too. And so you just figure things out as you go along. She survived and did really well. It was at a bad place to get your uterus exploded. And so, even now I still continue to pray for her that, if she did get pregnant again, that it was a safe delivery, that she was able to not have, that's a weak spot in the uterus. So during labor, especially, that part can tear open. We did a lot of counseling with her, language barriers and all that sort of stuff. But it's just one of those parts of war. This is a post-op after surgery, and a lot of and this is what the ER looks like, when you're done. This is the end of the day. Not all trauma. Some of us thought it was the best day when the Dallas Cowboy cheerleaders showed up, and some of us thought it was pretty cool when Lieutenant Dan Gary Sinise showed up. I've got to go to I got to see him play in concert. Yeah. So yeah, so it's not always bad. Um, so we threw a toga party. Three guys in bed sheets. What could be better? Drinking zero alcohol beer because we're allowed to drink zero alcohol beer. In the Islamic republics, we don't drink alcohol. So no alcohol, but we could have O'Doul's. You familiar with that? Yeah. Anyways, it's a joke, but we were doing zero alcohol, pretending to do zero alcohol beer bongs. Um, so really tough night. Had a 8-month-old baby who was about the size of an 8-week-old baby, who had severe burns, trauma. I had to put a chest tube in a 8-month-old baby. We had to create an incubator over here on the left. So I called back to Wilfred Hall, which is the huge medical center in San Antonio, to just get some advice from the NICU team there of how to do this. And so we were able to create a little incubator for this guy, severely hypothermic at the time, and pH was like 6. When I got on, pH was like 6.4 or something like that. So like really, really sick. But this is next morning when he survived, and it was a really, really great, tough night, great morning. In the meantime, back home, and those of you with spouses who may have spouses someday will realize that life in the military is a team sport. And so we had a big group of friends that would support my wife and kids while I was out in Iraq. So I just wanted to mention that as well as a huge part of being in the military. Believe it or not, I did a C-section in Iraq. So there was a gate guard, and the gate guard's wife was pregnant. And the Iraqi gate guard, wanted his wife to be delivered in the American hospital, felt like it was safer, whatnot. But that was not allowed, not possible. We were allowed to see people for life, limb, or eyesight, right? So if people were losing their eyesight, lost a limb, or they're about to die, then we could see them. So one night, she'd try to come on a couple times, and sorry, the answer is no. We'd love to help, but we're not authorized. We're not legally allowed to do that. So one night, her husband's working the gate, and he says, "Pass, go on through." So she ends up at our ER, and now she's contracting, she's spotting, she has a history of C-section, and so in that situation, you diagnose if they're in labor or not. And sure enough, she was in labor. We waited a couple hours. She dilated. So we ended up doing a C-section in Iraq. And the trauma surgeon's next to me, and this is probably one of his career highlights, is being able to deliver a baby, which is not something they get to do a whole lot. My birthday on the right. So one of my colleagues baked me a birthday cake. My wife had sent me like all the materials for one of the favorite cakes that I like, and we made it work. Pretty much, not quite as good as home style. A lot of exercise, riding bikes around Saddam's palace. Yes, this is, so you already noticed. I'm glad. I didn't know how this would go over. And I'm like, you guys do anatomy, sort of. So the guy up front, Jeff Neleslik, he's a urologist. And so in the desert, there are a lot of kidney stones. You'd be surprised how much the urologist is needed. And so he had his own little thing going, and he was 24/7. And so, but we would get on bikes, go down to the local Taco Bell, which was really there. So anyways, we got some, we adorned his bicycle with the appropriate accoutrement for a urologist. And I do have a picture of him sitting on it, and it kind of, anyways. John Martin there on the right of the photo, minding his own business out there doing his laundry, and there was a firefight at the front gate, and sure enough, he gets shot in the leg, and so he's hobbling his way back up to the hospital walking himself, and a vehicle comes by, and he says, "Hey, I need help. I need help. Can you take me to the hospital?" And I'm like, "Sorry, dude, we're full." And they just keep going. And he's like, "I got shot." He didn't tell us. So he walked all the way to the hospital. So Purple Heart guy, he was a neurosurgeon, and he was like the only neurosurgeon in like the whole southern part of Iraq. So if he left, there was no coverage. And so he said, "I'm staying." And they said, "No, you're going." And he said, "No, I'm not." And they ended up giving him a Purple Heart, and he stayed. So the picture on the right, the husband there is a German national who was working on our base and had a heart attack. And super complicated history, and was the guy that was taking care of him before I was taking care of him said, he's hospice care, like we're just going to let him go. And so I ended up tinkering with his meds a little bit. I called the cardiologist in the Capitol and got some advice. And sure enough, he made it through the night. He got stabilized. He got put on an airplane. And this is him in Germany with his wife. And so these are like, little victories. You're like, yes, and whatever part you play in it. Mostly, I think he just was meant to survive that, and I was able to help tip the scales. That's what we do as doctors, right? We don't save people. We don't really do anything. We help tip the scales in the positive direction, hopefully. Bill Bettinati here, he's our commander. He's sitting in the chair there. He was sitting in the chair where the guy in the red shirt is, and I was sitting next to him, and we had a round fall, sitting distance away from each other, fall right between us. So we called it Mortaritaville when we were there, and like we got 300 mortars a day and a bunch of shots. Can you guys guess which one's Noah? So I don't know. Maybe he's meant to be a surgeon. He's got his little surgeon's cap on there. But this is the return home, and another great day in my life. So I went on and did a fellowship in faculty development. So this is one where you just kind of learn how to teach and do adult teaching. And I was part of the residency staff at David Grant. And so they sent me out there, and that was a wonderful experience out at UNC Chapel Hill. Trying to paint this picture of a variety of stuff that you can do as a family physician. And I just got to do a whole lot. When I was at David Grant, 2010 was the huge earthquake in Haiti. I have to check this, but it might have been like the most deaths. And I think the deaths from that earthquake are hard to pin down. If you've ever been to Haiti, right? It's really chaotic on a good day. I remember flying into Haiti and be like, "Oh my gosh, the devastation is incredible. I can't believe it." And I'm like, "Oh no, this place wasn't affected at all. The earthquake was down there, right? Like half, it looks like half built / half destroyed, homes and stuff like that." Yeah, it's 2010. So I think by some accounts it was the most deadly earthquake in history. By the time we got there, a month after the earthquake had hit, people were still walking around with fractures. I mean, not walking, but fractures, open fractures, severe eye injuries, like this guy. I was able to take a resident with me, so that's Scott taking care of a patient there, and me not paying attention in the background. That's how it goes sometimes. I trust you. You can do this. It was at this time in my career, around 2011, I think it was. I took up an interest in overseas mission work. Really, that whole idea of like something I always wanted to be, right? But there's not really that category for it in American medicine. Place where you can go and practice full spectrum. Combine that with this teaching career that I'd been in, and kind of figuring out that I love to go places and do things, right? But that may not be exactly what the place I'm going to needs. We want to do something sustainable. We want to do something that's supports the community, take their capabilities and grow on that, not bring in a capability that they're not going to have a week after I leave. And so we started doing these courses and classes. I think I'm teaching advanced life support and obstetrics. There's also a basic life support and obstetrics as well, but just helping babies breathe, PALS, all the critical care courses, teaching those in a rural setting for people who are otherwise doing the best they can. And so I remember after this class teaching about management of hemorrhage. So you'd have midwives would tell us that the practice was to deliver the baby, tie the cord with a piece of cloth, and then put them in a cardboard box in the corner because that would determine if they were to live or they were to die. And that was the best practice. And this lady, after we talked about hemorrhage, she said, well, thank you for that. I could have used that, even just, I think it was a night or 2 nights before, where a lady had bled to death. I mean, this still happens all over the world, women bleeding to death from pregnancy complications. And so it was really great to teach like simple things like, put the baby to the chest. It's going to warm the baby. It's going to create uterine contractions, do some uterine massage. How do you assess amount of blood that's coming out? When do you decide to go to the hospital? Well, it determines how far away is the hospital, right? Like if you only have an hour to survive and the hospital is an hour away, you might want to go at the first signs. What are easy oral medications that you can have on hand that are cheap? Cytotec is like, I think, a penny for 100. It's super cheap. So it was a really great experience. And I had done trips where you go in and do things and it's fun and exciting, and then you leave and like, that was cool. And then later you learn, what's happening when I'm not there? And then done trips like this where you leave and you're like, this community has been empowered, and they have 30 midwives who have skills, and that they may teach other people. So we went to Germany next. This was Air Force Africa, USAFE. And I was mostly on the Africa side because that was my main interest. You guys might recognize Cinderella's castle here on the left. Part of what I did was as an 06 at this point in my career was I was an assistant to the person who was in charge of the medical care and all of U.S. forces, U.S. Air Force forces in Europe and Africa. And so we went through the Ebola crisis while I was there. I got put in charge of a $30 million program to help the nations of West Africa prepare. The temperatures at the airports, all that stuff was being developed at that time. And so we helped implement that. We had some money to do training, supplies, and that sort of stuff. We spent the time at the Kofi Annan Center down in Ghana. And anyways, it was an incredible experience. Lower right is Crimea. So while I was in Europe, the Russians annexed Crimea. And so I was part of a $40 million package of helping them on the kinetic side. So the Ebola was more of a civilian. How do you adapt military medicine to a civilian need, right? Military is really good at getting things done quickly. Well, when you really need it, right? Yeah. Let's be honest. But we can pick up a ICU and take it somewhere and help somebody. So we actually helped transport some of the Americans who got sick during the Ebola crisis. And then the Crimea annexation was really more of a military exercise and we call it EMEDS, which is the Air Force's modular approach to building up a hospital and moving it. So mobile hospitals. So we helped them with a $40 million package for that. And then the lower left was it was a joint task force between the U.S. and Israel on defense for ballistic missiles. So I was a command surgeon for that project for 2 years. I got to go to Israel several times to do inspections, exercises, stuff like that. And so three of the key things I got to do in leadership role. And I remember, being in your shoes, and I probably for the first 10 years of my life, I was allergic to leadership roles. I did not want anything to do with that. These guys are people who quit practicing medicine and now they're, telling other people how to do things. And I just didn't want that. I thoroughly enjoyed it while I was there. I felt like I made a huge difference. And again, just following my passion took me to places that I didn't know I was ever gonna be. And I think made a difference, in West Africa and in Israel. Obviously Israel is using those strategies that we're in partnership with. Many of them are classified that are keeping them alive today. And then the Crimea thing is still an ongoing. Well, the Crimea is not, but the Ukraine war is still an ongoing issue. I joined this thing called the International Health Specialist. They may have it in the different branches, but that's what they call it in the Air Force. And it's basically medical diplomacy. So being able to go and do go to different countries, I think it was 37 countries that ended up getting to visit, and do missions of trying to help people with air medical evacuation or TCCC courses. I think you guys take those here. So bring it, for example, taking the TCCC course to Rwanda and doing the course, right? And then picking the people who did the best in the course to become instructors, doing an instructor course, and then watching them do an instructor course, right? So it's the kind of the train the trainer model, and super meaningful, super fun. I got to see a lot of places. I love to travel. I think I, that purpose in my heart to travel, right? I want to travel, but I got married up with this mission, which is great. My next bigger leadership job was at Eglin Air Force Base as commander of a small hospital, all outpatient. The lower right shows you the Intrepid Center. So this was a center that was built. Actually, it was built after I left, but I was part of a team that helped. I didn't literally design it, but like put the requirements in to make this. So super proud of that. As you know, a lot of PTSD, a lot of wounded warriors, mental health, but also physical. So that was very meaningful. And then my last combat deployment was to Djibouti. This was the kinetic area was Somalia, UAE, and then the rest of the AOR, the area of responsibility, was really more sort of like this international health stuff that I was doing previously. And so got to go to a lot of different places. You'll see in the lower left, that is, that's I think that's Ugandan military. I can't remember, but they're in a pickup truck, a modified pickup truck. That's kind of like their little tank. There's a hero shot of me out here in the desert in Djibouti and Somalia. Super meaningful, lots of fun with that. Post-retirement, started a nonprofit. I wanted to continue to do something meaningful. I wanted to. I didn't really love corporate medicine. I dabbled with I'll just say a corporate hospital that you would recognize the name, and I didn't love it. It wasn't for me, and so I wanted a little more autonomy, and I wanted to be more missional. And so what we do through the nonprofit, or down here at the bottom, the far right is this Bay Area Medical Mission. We do overseas missions with that group, as well as local missions. The biggest one is at the San Francisco City Academy. It's a private school that was started in the Tenderloin in San Francisco. Really dangerous place, very underserved. You guys kind of know what I'm talking about there. And so it's a private school. They don't have a school nurse. They don't have funding from the state or the city. And so we go there, and we're their nurse. We're their school nurse. So we do the sports physicals. We do their annual physicals. We do eye checks. We refer for dental. So it's super great to be part of, another group that's trying to provide a way out for people in the Tenderloin. Release is birth loss recovery, so abortion, miscarriage, and also any other like loss of life during COVID. Became a big healing ministry for people who, they were separated. A lot of them were separated from their family members as they were dying. And I suspect maybe some of you in this audience have that experience of being separated from family members, or someone knowing that they were separated from their family members. The Afghan Refugee Clinic, I was a veteran of the Afghan War. August of 21, we had just a calamitous end to the war. I can talk more on that, just horrible way that we ended the war. But we ended up now over 30,000 Afghan refugees are in Sacramento. And now it's a population that is not being easily absorbed. Services are not available. We already have a crisis in healthcare where I say that, Medi-Cal or Medicaid is amazing. It's a great insurance. You just don't have access to it. You can go see anybody anytime for any reason, but you can't get there. It's, hey, I need to see an eye doctor. Okay, it's 6-month wait. In Sacramento, there are 2 ophthalmologists who accept Medicaid, 2 out of all of Sacramento. And then we got another 30,000 Afghan refugees that came in. So we decided to open a free clinic in Sacramento and serve them. And the idea is just to, be loving, be welcoming, be a great primary care, a place that they want to come. And although they have Medi-Cal, they don't go go to those facilities because they can't get in there. They come to us. City Free Clinic is another one in Fairfield. It's attached to a 35-bed recovery center. So really addressing the problem of homelessness, which is deeply intertwined with severe mental illness, drug abuse and addictions, sexual trafficking. So it's a one-year program, and we came alongside to be their primary care, and then I told you I had to learn how to do medical management of addiction drugs as well as severe mental illness. I had to learn how to do schizophrenia, how to do bipolar. I also serve up in Ukiah, up in the Ukiah Valley Medical Center, doing deliveries. So I'm up there for about 4 days a month, doing deliveries on labor and delivery and teaching residents. The lower left is a project in Ethiopia where we're investing time and talent, treasure there. And then the lower right is a mission in Guatemala. Those are our international links. And then with 2 minutes left, the idea was how do you fund all this, right? And so fundraising, nonprofit, grants, in-kind donations, those sorts of things go so far, but they don't go the whole way. And so to fund it, we're doing a direct primary care or concierge medicine, which might be a topic you guys are interested in. Basically, people are paying a monthly fee in order to have direct access to me. So you get my phone number, my email, you call me. And so people, it really is, we're attracting people who have money, who have expendable money and want the access, right? They have insurance, but they just want to be able to call their doctor whenever they want to call their doctor. So it's a huge privilege. We take 2/3 of that income and put it towards the nonprofit. So anyways, there's a lot of moral justification that goes into doing what you do. We can talk about how this ends up being fair and how it ends up being a good idea, and possibly one of the solutions to healthcare in America. And then we also attract a population of people who may or may not have money, expendable money, but they have medical problems that don't fit into nice, neat corners of our system. And so we get those people are willing to pay the monthly fee just to have somebody who'll spend 2 or 3 hours trying to noodle a problem, try to figure something out, working with people. So it's been a great experience for us. And then lastly, I just included some pictures of the family along the way. I would have loved to have told you all the cool things we did as a family throughout all of those years. But that'll be your guys' story. You guys will have a career similar, better than what I did. You'll follow your passions. You'll do cool things. You'll end up in great places. And you'll have a beautiful experience with your family. I would give you this piece of advice. And Noah, I don't know if I gave you this advice before, but thank you for what you said about me when it came out. It was meaningful. But I'll give you this piece of advice. If you ever get the chance to stand in public and thank the people who got you to where you are, don't ever miss that chance. So, I thank my wife for standing behind me for all these years. She served just as hard, just as long as I did. And anybody who's been in the military, who's been a physician, knows, it's not a 40-hour-a-week job. And so there's many of those hours that she put in that she didn't get paid for. She didn't get no ribbons on her chest, no awards, right? No photos in the newspaper, all those sorts of things. So I thank you for that and all the love and support that we've had along the way. And for someone like Noah, sometimes you think that, gosh, aren't you proud of him for being in medical school and being so fit and so kind and so generous, right? And it's like, well, yeah, but I'm proud of him for who he is. If he was the janitor at this school, I couldn't be more proud of him. And not everyone's going to be a doctor. There's some people are going to have other jobs. But you can do it in a way that can make your father proud. And so that's who Noah is to me. Is no matter what he does, right? Just you guys know him, right? No doubt, no doubt. Good kid. So, okay. Well, I know my time is up. I appreciate you guys being so attentive. I'm going to stick around afterwards for questions. who can I turn this over to? I'm looking, no, should I turn this over to you? Yeah, I'll take questions now, but I think you probably have to go.
Thank you. Thank you. Okay, so yeah, we'll do questions now. If you're on Zoom and you have questions, no one's really monitoring the chat, so. Oh, never mind. I'm so sorry. Emily is so amazing. Emily is on top of it as always. Um, yeah, but feel free to unmute her. I guess Emily's monitoring it. If you have to head out, yeah, please go do your things. Enjoy your day. But if you have
Thanks.
questions, we'll stick around for questions, and I'll hand you the mic if you have a
Yeah, thank you.
question so the people on Zoom can hear.
Yeah. Yeah, thank you. Yeah, good luck to you. I know you did great. If you get orders.
Are you still proud of Noah, even though he joined the Army and not the Air Force?
Yeah. That's a great question. At the end of my career, I got to do a lot of joint assignments, and I have a tremendous amount of respect for the way the Army Medical Corps is set up. I will say I would prefer almost any of the Air Force base assignments over the Army. We have some really great base assignments, but the way the Army Med Corps is set up is super professional, and I during my tenure, right, things may have changed by now, but during my tenure, I think it was a better organization than I had in the Air Force. Yeah, yeah. So I am proud, and I think it's a smart decision. Yeah, yeah. Mhm.
Yeah, we definitely prefer the Air Force base.
Yeah,
Like that right now.
yeah, yeah, yeah. And I prefer the deployment assignments. Most of the Army guys went on a 12-month deployment. And sometimes they were like, oh, yeah, it's 12 months, but there's 2 months of spin up, and a month of spin, so the 12 months ended up being, 14 or 15 months. And the Air Force deployments were 6 months that sometimes turned into 6.5. So,
I have a question. So I'm Navy, and this might involve maybe some responses from your family as well. So I know that you got deployed across the world, and then were stationed in like Germany, for example. How often was your family able to come with you, and how well were they supported, and having like all the resources they need, the availability to go out in those countries and do fun things and experience life still?
yeah, that's great. So I said some nice things about the Army. I have nothing nice to say about the Navy. No, I'm just kidding. Totally kidding. When I was stationed in Djibouti, and it's a Navy strong environment, and it's super professional, great group. I think you're going to really like it. Your experience will be a little different in terms of being on a